Hi everyone. So I want to go over today and really simplify skincare. I know many people think of dermatologists as the expert of skin, but as a cosmetic surgeon, plastic surgeon, I do a lot of face surgery. And as part of that, skincare is really important for me to get the best outcome. So I'm also very interested and focused in skincare. And I'll give you a practical plastic surgeon version or understanding of skincare, which I think will also help you think about this without all the noise and clutter. I'll just really simplify it. So if you were to look at, this is the conversation, right? Skincare simplified. The general well-being disclaimer, which is not ever going to be replaced by any treatment, really is about having proper mental health, nutrition, optimization, sleep and lifestyle optimization, adequate hydration, proper titration of nature exposure, sunlight, air, and all that stuff. This has to be in the background always. There's no substitute for this at all. Nothing of this is going to substitute for that, okay? So that is the general guideline. Then if you look at the skincare and break it down into different categories, you can generally put it into 4 buckets. The first one is topical skincare. The second one is mechanical skincare. The third one is chemical skincare. And the fourth one is energy-based skincare, where you need some intervention beyond these baseline things that I spoke about. If you look at the topical side, essentially they're products, right? I mean, there's a gazillion products out there. There's natural products, there's synthetic products, there's a combination of products. And these products you can buy online, you can go to the store like Sephora or wherever, or you can buy it at doctor's offices. Typically, products that are at doctor's offices are supposed to be a bit more focused and a bit more researched and a bit more endorsed, I suppose, by somebody who focuses on skincare as a professional. The online market is also fine. A lot of people use them. They're perfectly fine as well. But for certain periods of time, maybe around surgery, maybe around a treatment, a doctor recommended product line may be better for that, okay? So that's just the simplest version that anybody can do on their own. The mechanical version of this, again, can be broken down into various components. There's something called microdermabrasion that an esthetician does that is very shallow, where that actual mechanical device is used to basically take off or scrub off the surface of the skin. Dermabrasion is something that a more trained professional will do, like a healthcare professional, where you actually go deeper into the skin that can injure the skin, the top layers of the skin, which an esthetician would not necessarily do. So microdermabrasion, micro is the very small amount. Dermabrasion is a much more deeper, aggressive version. Facials could be considered mechanical, massages can be considered mechanical, and cupping can be considered mechanical because they're mechanically changing the skin. And so this is the bucket of mechanical version, and different professionals do different things. The only thing that the physician would do in this case is probably dermabrasion. Everything else can be really done by an esthetician. On the chemical side, you have peels of various kinds, and peels can be broken down into 3 versions: a light peel, a medium peel, and a strong peel. In the light peels that an esthetician would do for the most part, or you can do it on your own, which are acid peels like salicylic acid peels, kojic acid peels. Sometimes they can be bought and done at home. So that's a light peel that anybody can do. For a medium peel, there are other products like TCA, sometimes called a VI peel, and all these other versions branded that an esthetician trained person can do. Strong peels can be done by a physician that can include phenol, croton oil, or a very strong version of the TCA that has different degrees of penetration of the chemical into the skin. Then you have the energy-based skincare that includes lasers of various types, radio frequency treatments of various types that has microneedling and other components, ultrasound, etc. So all of these essentially is a very simplistic way to understand skincare. So the goal of all of this obviously is to somehow either mechanically, topically, chemically, or energy-based to change your skin so that the healing component creates healthier cells, healthier process, healthier physiology, and healthier maintenance of your entire skincare. So I hope this is a broad summary of how to think about skincare, and then you can drill into individual treatments separately on another video, which I will do later. Thank you so much.